So, welcome everyone. Thanks for joining us from different countries around the world. My name is Kelsey Lee, and I'm Managing Director of Sincoheren. And today we're very lucky to have Dr. Shehla with us. She is very popular with over 15 years in this industry. So today's topic is hair removal and hair removal treatments and technologies. Please note that this session will be recorded and the link will be shared with you if Dr. Shehla gives the permission afterwards. And no confidential information shall be shared within this in this webinar. All speakers express their personal views and opinions. This is not necessarily the official Sincoheren opinion. And please make sure all of the participants in mute mode while the lecture is on. There will be question and answer time after Dr. Shehla finishes her lecture. And so now, let me see, we have 2 minutes to go until we have Dr. Shehla starts. While we wait for other participants joining us, let me see. And do you have anything to remind us, Dr. Shehla? You have you have your microphone. You have the mic in mute.
Yes, I was actually waiting for everyone to join, so I can just start with the lecture. I think I can see a lot of participants already. They have joined, so we would like to welcome them as well. So
yes,
just give another like 2 to 3 minutes, and then we will start.
Okay. We have we have more and more participants joining us, so while we are waiting, hi, Dr. Sikada, and have Pigeon, Cris. Okay. We have another minute to go. Thanks for joining us, everyone. We have Dr. Rana, and we have
so how many participants have already joined, Kelsey?
Until now, we have about 20 participants joining us in this seminar so far, and I think since it's time, we should start.
Do you want me to start?
Yeah, I think we should start since it's 10. I mean, it's the time already. We have many participants waiting online already. Thanks for being on time. Since this is the first webinar we're having in terms of hair removal treatments and technologies, we're very excited to have Dr. Shehla. And yeah, I think we should proceed to you, Dr. Shehla.
Okay, thank you so much, Kelsey. So first of all, I would like to Thank you, Kelsey, the whole team, Sincoheren, and everyone who's joined me in the Zoom meeting, for joining us, for giving me an opportunity to talk about the lasers and the new technologies we are using these days. So I can see a lot of participants already, they have joined. So I would really like to welcome them for my lecture. First of all, I would like to introduce you myself. I am a medical doctor who have more than 15 to 16 years of experience in aesthetics, lasers, doing the laser procedures and anti-aging procedures in my home country. And I am a member of American Academy of Aesthetic Medicine and Surgery of New York as well. So today I would like to talk about the technologies which we use for the hair removal. So basically, the main topic would be definitely the lasers, but I would like to tell you the other technologies previously, which the doctors and the other people were using. So let's start the lecture. I would like everyone to mute their mic and just give a little a concentration on the lecture. So I think we should proceed. So I'm just going to try to give you the first introduction, what we are going to just learn in this lecture. It is the introduction. It's about the skin, how we classify it. Basically, there are a lot of classification available in the market for the skin. It's basically the color. And we will talk about hair. Definitely, we are doing the hair removal. So definitely, what is the medium which we are going to work? So that is the hair. Then it's growth phase. Then the hair removal methods. And then the laser types. So I would like to share the screen so you can see the lecture. I hope everyone can see.
Yes.
Yes.
Yes, yes.
Maybe have it on full screen. Yes, good. Thank you.
So this is the first, just a little bit introduction I've already given. And this is the main topics we are going to discuss today. So again, I welcome all, the one who are joining now. So basically, it's the introduction is yes. So we are going to do the classification of the skin. We will talk about the hair, its anatomy, its growth phases, what hair removal methods we are using. Then we will just talk about the laser hair removal technologies, the different kind of lasers we are using, what are basically the laser types, how does it work, its physics, the main lasers and the IPL technology we are using. And then we will, in the end, we will just do a little bit of comparison between the different lasers so you can understand what is the difference between the different types. So it will be really easy for all of you to select. So as all of you know that, skin is the largest organ of our body, and it covers the surface area is 1.5 to 2 meters square. And its weight is around 18% of our total body weight. And it has like different layers. The top layer is the epidermis, on which we target our laser, but epidermis is like 0.3 to 1.5 millimeter. Then the second layer is we call collectively dermis, that is 1.5 to 2.5 millimeter square. And in that dermis, we have the hypodermis, subcutaneous, and fat layer. So collectively, the dermis is like 2.5 to 4 mm. So it's really important to understand the skin first, because, in IPL, your targeted area where you're going to just apply the lens, the laser lens, is the skin. So as you can see in my slide, it's the top layer, the epidermis, this one. And then this is the dermis, that is 1.5 to 2 mm. Then this is like the subcutaneous layer. So you can see the hair follicle, it's just deep rooted inside. It's in the dermis. So whatever we are just using the laser, the skin is involved and deep rooted dermis is involved. So this is the classification of the skin. It just tells you the color of the skin. It starts from type 1 to type 6. Type 1 is light color, pale or white. In the sunlight or in the exposure with the sun, it always burns, never tans. Type 2 is white, fair, usually burns, tans with the difficulty. And type 3 is medium or white to olive. It's sometimes, mild burn, gradually tans to olive. Why it's important to have an idea about the classification of the skin is really important, because, you have to select the energy according to it. So type 4, type 4 is the olive tone. It rarely burns, tan with ease to moderate brown. Type 5 is the light brown, and type 6 is the dark brown. Yes. So we have talked about the skin, its classification. Now we will just see what is basically a hair follicle. It usually originates in the epidermis. So that is the top layer, which is 0.5 to 1.5 mm. And the follicles on the scalp, eyebrow, and eyelashes, they extend to the epidermis, dermis, or hypodermis. It varies from patient to patient or client to client. Then we will talk about the hair anatomy. As you can see in the slide, As you can see in the slide, that this is the skin surface. This is basically the outer part of the hair. And this is the bottom, that is the follicle or the bulb or the papilla, which we really are going to target when we are just going to do the treatment. So basically the hair contains like surface, follicle, bulb, papilla, sebaceous glands, sebum, and hair erector muscle, where the hair is joined. And then the function, what does the hair do? It just regulates the body temperature. Okay, now it's really important to understand the hair growth. Once you are doing the laser hair removal, you call the patient like whenever after like 3 weeks or a 4-week time To understand that, you need to understand the phases of the hair growth as well. Basically, like there are 3 phases: anagen phase, catagen phase, the telogen phase. Anagen phase is the proliferation phase. New hair grows in this phase, and hair follicle is growing a new hair shaft. Length of this phase is like 2 to 6 years. But in this anagen phase, the hair grows basically, and you have to call the patient an anagen phase. Catagen phase is the transition or the regression phase. It is the shortest of all 3 phases and lasts only a few weeks. Telogen is the resting phase and shedding of hair, hence new hair grows in anagen phase. Length of the hair follicle is 4 to 7 mm. So previously, what were the methods? We can do like spa treatments. Spa treatment, they do the threading, waxing kind of things. Then in the initial technology was the electrolysis. They were using the electrolysis method. The first kind of technology we came across was the IPL, that was intense pulse light, and then the lasers. So we'll come about laser hair removal. So laser hair removal. First of all, what does laser stands for? It's light amplification stimulated emission radiation. For any of the laser to target, we need a medium. So that we call it a chromophore. For hair removal, laser hair removal, we need a melanin. And the hair contains a melanin. That's why it's like a dark color, the black color or the brown color. That is the pigment inside the hair. So we need to target that. And the technologies used are intense pulse light, that we call is IPL, diode, that is the most common. You must have heard like soprano or the ALMA lasers. Alexandrite, very common. Nd:YAG laser, most common, but because it is like very safe for the dark skin and the dark hairs as well. So it really works well and on great for skin as well. So, and the ruby lasers, but right now, most of the lasers are the top one, the IPL, diode, Alexandrite, and the Nd:YAG laser. So you can see there's one slide in which they have shown the method that how we are going to do the laser hair removal. So we just apply the gel and we are doing it. So you can see a slide where there's before and after is shown. So this slide is really important, in which we can see the energy. It's just going down and targeting the root, that is the bulb papilla. You see the third slide. So these are the laser properties. How does it work? It's monochromatic. It's single range of wavelength color. Collimated, travels in a straight single direction. It do not disperse. Coherent means all the waves are in just straight one line direction. It's one wave moving together at the same time. So wavelengths for any of the medium, any of the laser to work, we need a wavelength. For diode, it is like 808 to 810 nanometers. For Nd:YAG, it is 1064 to 1340 nanometer. Alexandrite is 755 nanometer. IPL is 420 to 1200 nanometer. we use like different kind of filters in IPL to work because IPL is a multitasking or multifunctional equipment or the technology or the machine. So it has a different filters if we are targeting for the hair removal or for the acne, for the pigmentation, we need to change the filters accordingly. But a few of the new, the new technologies in the market, in that we don't need to change the filters. They have like inbuilt system. They automatically change it. So this was the wavelength of the different lasers. You see in the first slide, there's a picture that there is a light bulb. This one, and this is the lens, how the light is dispersed. So it's most like the widespread kind of light in the intense pulse light. In the laser, it is more focused, more targeted. So this is the lens or the skin. So basically, now we talk about the laser physics, how it is, for a laser to work, we need a flash lamp, the power source from where the energy will come. We need electricity or another laser medium, that is KTP and DAG. Laser mediums are different for the gas. If you're using the CO2 laser, the argon laser, the krypton laser, if we are using the liquid, the pulse dye laser, rhodamine, curamine, fluorescein, and the solid is the KTP, YAG, and ruby. So today we are just talking about the IPL. So the power source is the flash lamp. And in the laser medium, we are talking for the YAG, so that would be solid. Optical resonators are the mirrors and the cylinders. Delivery system is the optical fiber and the handpiece. So the energy is basically delivered from the handpiece. Important terms we need to see is the wavelength. That is what I told you before. It is for the diode, it is 8 to 10. That is distance between the peaks of a wave. Energy is basically the joule. It comes in the joules. It's a number of photons. Fluence, energy delivered per unit area. In that particular area, we call it a fluence. And then power or the watts, it depends on the, we just see how much watt is the machine, how much the power it can give. That is the rate of the energy delivered. Pulse duration to deliver energy. So it is in between the two, the laser shots. So let's talk about the IPL first. So it is basically the intense pulse light mechanism. How does it work? It is a broad bandwidth of light wavelengths. It uses like flash lamp, as earlier I told you that it is a power source, is basically a flash lamp, and it has like a different series of filters through which we work. It is a very cost-effective machine, and multi-purpose treatment we can do. Like if we are just selecting only one machine, we can do a lot of treatment with it, like laser hair removal, acne, superficial vessels, pigmentary disorders, toning, photo damage. The good thing about the IPL is that if the patient or the client comes after the sunburn, or he or she has visited the beach, so the other lasers won't work, we can just remove the photo damage with it as well. So it can be used in combination, like for some clients, if they have like different kind of hairs, the darker hair or the lighter hair, so we can just use in combination with the technology like Nd:YAG and alexandrite and the IPL for the better results. Because sometimes, if you're using the best of the technologies, some patients are not getting the results. So we can use the combination. It is suitable for light to medium skin tones. because there is a little bit chance of just burning of the top layer, that is the epidermis, with the IPL. And it is suitable for natural blonde to dark brown or black hair, and not effective on blonde, red, gray, or white hair. And you have to remember that on the white hair, no laser can work. So ultimately, we have to go for the electrolysis. And on the blonde hairs or the fine hairs, we can use the alexandrite. So how to do the treatment? Basically, first we will just shave that area. We need to have the root, so it should be properly shaved, not tweezed, not waxed. And then we will just apply a laser gel on the target area. We can do a whole body, but definitely with the IPL, it's a little bit slow treatment. So we will prefer the diode or the antiaging one. And the basic sessions are 6 to 8. And then after 6 to 8 sessions, we will require the maintenance sessions. And the gap depends, like initially, if the patient comes to you and they have already taken a lot of sessions, you can see, you can call them like whenever they're the hairs, or in the initial time, 2 to 4 weeks gap between the session, depending on the strategy of the doctors, how they want to proceed with that. Efficacy depends upon the hair color and the type. Like if you're just targeting the IPL on the lighter hair color, definitely it won't give you that much result. It's really good on the darker hair, on the thicker hairs. So after 6 to 8 sessions, maintenance sessions are required. So we can just call them after like 2 months or 3 months to maintain the results. Endpoint is once we are start the treatment and we can just see a little bit of the redness, we call it erythema or edema on the epidermis. And it's a little bit time consuming because it's a little bit slow treatment and it's less effective on body, yet it has a quicker effects on the face. Contraindication definitely is pregnancy, lactating mother, children under 12 to 13 years, definitely the above teen, it's preferable to just call them for the laser hair removal. As you can see, this is the picture which I've just tried to show you. That is the IPL device. It has 2 handpieces, one for the hair removal and one for the other treatments, that is the acne treatment, the pigmentation, the toning, and the superficial vessels. Now comes the diode. Diode is the most common. You must have heard like the Alma or the Soprano one, and its wavelength is 808 to 810 nanometers. That is the best wavelength, exactly where the root hair follicle is, and it is suitable for all skin types. So it can be like the treatment of choice or the the laser of choice, because you can target any kind of hair or you can target any kind of skin. It is safe, it is effective for even the lighter and the darker skin tones. So if you are in any country doing the treatment for different kind of skin tones, so it is really effective. And it uses photothermolysis to target specific chromophores in the skin, and chromophore is the melanin, definitely. And it has very superior power of absorbing the melanin, and it offers deepest penetration, better than the IPL, and its wavelength penetrates more deeply into the skin. It reduces amount of energy absorbed by the epidermis. That was the point which earlier I was trying to tell, that why the skin we need to understand, because that is the first part to come in contact. So if all the energy is absorbed on the skin, so you will have a lot of burns, and the energy is then not absorbed directly through the hair follicle to the root. So the diode's energy, the absorption level is really good, and it uses like semiconductor technology to produce coherent. So I told you in the beginning, the monochromatic, and the second one, and the third, the coherent one. So it uses the coherent method for the projection of light. It uses light beam with narrow spectrum to target chromophores in the skin. How we do it, it's pretty much the same. If we shape the area, we apply the cooling gel, and it heats the selected chromophores and leaves the surrounding tissue unharmed. And the melanin, of course, melanin is the hair. The darker the hairs, they have the melanin pigment. So that is a chromophore. It is targeted, and it has like complemented with the cooling technology. It has like the contact cooling, because we need some, basically the laser, it has a heat. So we need some method to cool down the skin as well, or to provide, the cooling effect of the skin. It's like 6 to 8 sessions are required. Redness and swelling you can observe after the treatment. Endpoint is again the perifollicular erythema or edema. And later we should avoid scrubbing, exfoliation, direct exposure to the sunlight. These are the points we should, make sure after the treatment that we should take care. So the third laser type which we use is the antiag long pulse laser, and we can use it alone, and we can use it in combination with the alexandrite. If we are using it like the simple antiag long pulse, it's really great, good for all skin types, but especially good for the darker skin, darker hairs, and if we are just in the European country, or if we are in America, we are just having a white, the grade 1 or 2 skin, and the color of the hair is blonde or they're fair. So NDAG is the best technology to use. And the mechanism is like, NDAG is basically neodymium doped yttrium aluminum garnet. And it is used alone or in combination with alexandrite. It is solid state laser, and it just the wavelength is 1064 nanometer, and there are other diode as well, which has like 940 nanometer, 1440 nanometer, 1120 nanometer, and 1320 nanometer wavelengths. And it is a gold standard for skin types 4 till 6, and can be used on the tan skin. So that is a really plus point. So what we will do, we will just shave the particular area. No need to just apply the gel. And post the treatment, we will just apply the sunblock. 6 to 8 sessions again are required, then the maintenance sessions, and gap of 3 to 4 weeks between each session. If you're just doing the IPL treatment alone, or the diode, you can even call the patient after like 2 weeks to 3 weeks, but in NDAG, we definitely have to give them like a 4 weeks time. The energy is more, the absorption is more, the depth is more. So we need to just give a little bit of gap between like 3 to 4 weeks. Results vary from patient to patient. Some, patients come and they say, we have a beautiful results with IPL, and a few of them, they say we are not getting any kind of results with the NDAG long pulse as well. So it just depends on patient to patient. And when to end the treatment, it is when you just give a shot and you can see a perifollicular erythema or edema, that is a redness kind of thing, that is the end point. So benefits of NDAG long pulse, it's the deepest penetration, air cooling. We use a separate Zimmer device or the air cooling device. And then it is like, it has a superior results, definitely comparative to the other technology like IPL. But the studies have shown that they have like a very similar results with the diode one. Few patients prefer treatment without use of gel. Some say it's like, we don't want to use the gel, so it feel easy. So they can prefer that. Number of sessions are definitely less because of the depth and the energy it is absorbed. It is like quick and the fast. The doctor is also, happy just to finish the treatment quickly. So this is the basically, I have actually made the comparison between the three technologies we use. So it's really, for you people to understand if you are the initial buyers or you have just started the practice, what to exactly which equipment you should go for and which technology will really help you in your setup. So this is like IPL, diode, and antiaging. So IPL is pretty much very economical, less price. Diode is again like economical to slightly costly depending on which company you're just choosing to buy a laser. And antiaging, definitely, it is a slightly costly laser. And the skin, light to medium skin for the IPL. Diode is really good for light, medium, and dark skin. So that's an edge. NDAG is really great for the dark skin. So it's really great for the olive skin or the subcontinent type of skins, the grade 4, 5, 6. And then the IPL can target the thick, coarse, dark hair. And the diode is normal to thick, dark hairs. And for NDAG, thin, thick, light hairs. That is like, again, a plus point that with the alexandrite, we can target the thin hair as well. We can target the light hair as well. We can target the thick hair as well. So that's, again, an edge point. And then 50 to 60% of hair reduction we can see in IPL. Diode is like 96% of hair reduction, NDAG 94% of the hair reduction. So, the diode got a better hair reduction results. IPL is basically a multifunctional. So you can do the laser hair removal, you can do the acne, you can do the pigmentation, you can do photo damage, you can do the laser toning. Definitely, we won't be able to get that superior results are you getting with the Q switch or any other laser for the pigmentation or the toning, but still it helps in lightening the skin as well. So diode only do the laser hair removal, and NDAG it do the laser hair removal only, but the one with the alexandrite, it has a genesis mode, that is a toning of the skin. And it really helps in removing the fungus of the nails, that is in the fingers, the toe. It's really helpful in that. So, and the minimum, like IPL, we need like 6 to 12 sessions, 6 to 8 sessions for the diode, and 6 to 8 sessions for the NDAG long pulse. IPL is like time consuming. It's like kind of a slow treatment. And for doctor, it's like, the smaller areas are preferred for the body. It becomes really time taking. Diode, it's really quick and fast. It's very similar with the NDAG. When we come to the body, IPL has a little bit low results on the body, and with the diode and the NDAG long pulse, it shows good results or the great results. IPL is basically a low maintenance. It only has a flash lamp. It's not, as I told you, it's not as costly, and it's a low maintenance kind of equipment or the machine. Diode is low to moderate maintenance. NDAG is definitely the definitely a superior technology, and it has a moderate kind of maintenance. Filters change, we need filters to change for every treatment. In diode, we don't use any filter. In Nd:YAG, we don't use any filter. Then there's like, please can you mute your mic? Then the gel is required in IPL. Gel is again required for the diode, and for Nd:YAG long pulse, we don't use any kind of gel. Shaving is required for all three. And in the first two, IPL and the diode, we have the contact cooling system. But for the Nd:YAG long pulse, it just, I told you, the air cooling, that is the cooling system attached. Some of the technologies, they have kind of contact cooling as well. So if you are a beginner or a doctor and you have just started your practice, the factors to consider prior to buy a laser hair removal, that's really important, because once you know, if you're a distributor, all machines fits for all, but and the salesperson, it's again a really different kind of thing. But for a doctor, they have to see, are they a beginner or a specialist? Means, have they enough, do they have the enough experience of doing the lasers, of operating it? Can they handle the technical one? So they need to consider, are they the beginner or the specialist? Ultimately, you know, being a doctor, you need all kind of technologies or all kind of devices at the clinic. But at the beginner level, you can just see if you don't have the enough money, and you're not trained, you know, enough to just operate on a technical laser. So you can start with the IPL or the diode. It is really cost effective. You know, you have to see how much you want to spend. Then you can decide which technology or which, you know, the method or the technology or the machine you're going to just buy or keep at your practice. And it should be result oriented. It doesn't mean that like you don't have like, you're just having something and it's not giving you the results, your patients are not happy, so there is no point. Then you can see that if you are a beginner and you don't have like, you know, that much revenue to spend on, you can just start with the IPL, that is a multifunction or the multi-purpose one. So, but if you're looking for, if I'm just want to do, I want to be the specialist in that particular treatment, then you have to just specifically design, you know, the technology or the machine to operate. Like if for the laser hair removal, you really need a diode or the Nd:YAG one. And then again, you have to see what exactly your clinic needs, what kind of patients comes at your clinic, and how much the patients are satisfied. And then after all, definitely you can upgrade your machines anytime. These are a few of the, I think, Sincoheren devices. That is the IPL one, and this is a diode. So basically, they have the Nd:YAG long pulse and the alexandrite as well. So that was my lecture for today. I actually try to design my lecture for everyone so they can easily understand. So I have to just, you know, the focus on the technology, the latest technology, so they can easily select the technology, what they should buy and what they should look for. So I'm done. I'm finished with my lecture. I really thank you all for everyone who have joined us. And I can just, I'm available here right now for your question and answer sessions. So if you have any questions in your mind, so you can please ask them. If you will ask my experience about, because, you know, I'm the only kind of doctor right now in the Pakistan's practice who have used almost like the 3 technologies of different countries. You know, it's just like I have used the American devices as well, the Korean devices as well, and a very good Chinese devices as well. So a comparison, I can easily make that. You know, I was really happy with the diode results. I am satisfied with the IPL as well. I am really satisfied with the Nd:YAG long pulse alexandrite, because I incorporate like 3 technologies for any kind of patient. If any of my patients are not getting results, I can just give them the combinations and just to give them the best results. Thank you. So I'll like to give my mic to Kelsey. So if she can ask if any of the participants have any question.
Yeah, I have a question. I bought the ND already, so I need to do I need to know how many treatments can I do in one day.
Please, can you repeat your question?
Yeah, how many treatments can I do in one day?
For different patients?
Yeah, different patients.
Which machine are you talking?
The ND.
Nd:YAG?
Yes.
Okay. So you mean if you're doing, you can do as many clients, you can give a gap between the treatment for just, you know, if you're just doing the face, it's just like a 5 to 10 minutes treatment. So you can give a 10 to 15 minutes gap between the 2 patients, and then you can go on with it. So it doesn't mean that like you can do only 10 treatments a day or 15 treatments a day. So it's not like that.
Okay.
But if you're just doing the body, definitely you will just give a rest for the 10 to 15 minutes, and then you can do another patient.
Oh, okay. That's my question. How long I need to wait for the next patient?
For the next patient to take, it's just 15 minutes gap. That resting period, that would be 15 minutes. Like you have done 4 or 5 clients or 4 or 5 patients, then you just can give them 10 to 15 minutes rest, just have a coffee or a tea break, something like that, and come again and do it. Because they are really, you know, stable equipment. They're not like that. If you just you do one treatment and it's getting hot. No, it's not like that.
Okay. Thank you.
Most welcome. Anyone else?
Dr. Shehla?
Yes.
We have someone on the we have someone in this webinar asking, can you use diode HR on African American people? That's one of the questions they posted.
Okay, African American skin would be, classification would be definitely 5 and 6. The safest treatment, we can just do it with the Nd:YAG long pulse alone. But if they don't have it in their practice and they have the diode in their practice, they can keep the lower energy and they can do it safely, but not with the high energy. So they need to keep it in mind that they have to use the lower energy. And they won't repeat the treatment. They won't call the patient after like 2 weeks. They definitely have to give them a gap of 4 weeks in between the 2 treatments.
Okay. Thank you, Dr. Shehla. And we have Dr. Saleh asking, Dr. Saleh, you can actually have your microphone on and asking Dr. Shehla. In case you're not available to talk, I'll repeat your questions. So Dr. Shehla asking, are there chances of paradoxical hypertrichosis with diode?
Hypertrichosis?
Ma'am, I wanted to ask
Yes.
about the paradoxical hypertrichosis. Can we get it with diode as well or not?
You know, it's just a condition. We don't come across so commonly. It's just like after like 100 to 200 patient, one patient. Like in my 16 years, 15 years of practice, I haven't come across these kind of things. But sometimes, you know, once in a blue moon, some patients can have it, but they can have it with any technology.
Can you hear it, Dr. Saleh?
Yes, thank you so much, ma'am.
Okay, thanks. And
actually, I tried to prepare my lecture very precise. So even if I'm just telling them or just try reading it, so the information is exactly to the point. So once you will go through again my lecture, you will understand exactly what kind of, you know, the technology is made for. You know, it will be really easy for them that what kind of technology they should select for what type of hair and how they should proceed with that.
Okay.
Hi, ma'am. Dr. Raj here.
Hello.
Hello, how are you, ma'am?
Yeah, I'm good.
Maybe get this presentation or any recording of this slide.
Yes, I think you were recording.
Yes. Yes, we do have this presentation recording, and with Dr. Shehla's permission, we will have this recording get it sent it out to the participants.
Okay. Thank you so much.
I think we
We'll
have
be waiting for that.
Kiran
So nice.
asking. Okay, not a problem. Do you have questions, Kiran? I see you're waving.
Please ask Kiran to unmute her mic.
Okay. We have some questions.
If a patient have multiple types of hair, thick hair or thin hair, so can we combine two treatments, two lasers at a time? For example, if we do diode and antiaging, right? Can we do at the same time?
No, not the same day. You have to be not one technology one time and the other technology the next time. So the next sitting. So that is like one technology in the one sitting and then other technology in the next sitting.
Okay, thank you.
Can you hear me now?
Yes.
Hello?
Yes, please.
Okay. It's me, Kiran Khan.
Yes.
Yeah. If you can hear
Yes.
me, I can ask my question. I'm Kiran Khan from UK, and I just need to ask how long the handset's life, because after a certain shot, you have to change the handset. So I just need to ask how long it can last long, the handset. So how many shots in one handset?
It all depends, like it differs from company to company, and you know, mostly some have like 10 million shots in each side in the NDAC. It just goes a long way.
Yeah,
many patients you can do like 2 to 3 years, 4 years. You don't need to change in the diode and in the IPL,
In
you
the
need
diode.
to change the hand.
Yeah.
In the diode, you need to change the
Diode.
handpiece. It's like 10 million shots. I think but it varies from company to company. So you have to see
Yeah.
which, from where you're buying, how many shots they're saying. Many
Using, yeah.
of the companies these days, they are claiming that it's like the shots are unlimited, but basically, are they just giving you the guarantee for the energy? Is it going to be stable or is for very long time? So that is a big question to just see.
Another question, after after 2-3 years, like they go, strength is go less or still the same? Strength of the handset is still the same when we're using lots of short. So after like 10,000 or 1 million shots, the strength is going less or is staying the same of the handset?
It all depends how many patients you have done, how many shots you have used. If you have not used it much, definitely it's there. You can use it for a very long time. But you need a maintenance. You
Yeah,
need
of
to
course.
just replace the water on timely.
If we need a
and,
service, yeah, if we need a service, so we are in UK and we buy from the China, so who's going to do the service
Believe
of the
me,
machine?
the IPL and diode, they are so user friendly. They are so doctors friendly. They don't need much maintenance because they have a very specific 2 or 3 kind of things. The water kind of thing, which we need to just change like after 3 or 4 month time, just to replace. Even that's my personal experience. I as earlier I told you that I'm kind of a doctor who has all kind of machines from different countries in my setup, and I'm really happy and enjoying the Chinese machines and technology equally good, because
Yeah.
I heard a lot of things that they are not good. You will require that much, even if I don't have some kind of a maintenance person here to help me out, but I haven't faced any kind of problem. Just a little bit
Actually,
of,
in
it all depends. The electricity should be proper. The person who's operating on the laser, that's really, a main person, because that person knows how to operate a machine. So I don't think so anything will happen.
Actually, in UK, there is for the insurance purposes, we have to have the services every 2 to 3 years for the machine IPL laser. If we claim to the insurance people, they ask us, when did you have a last time your maintenance of the machine? So they need. That's why we asking this question, because in UK for the insurance purposes, they ask you, when did you last time have your machine services? So they ask this question, insurance people. So that's why it's quite important.
I hope from wherever you're just buying, they will definitely, be able to answer you how they will be giving you the maintenance for that. But as I told you, that like antiag, long pulse, and Alexandrite, that is a very technical, machine or the equipment. But diode and IPL is really user friendly.
Yeah, because I'm using IPL from last 15 years. I have a machine as well, and I'm using in UK from last 15 years. But maybe I'm thinking about to use another new one, diode one, maybe. But I'm already using.
You should switch to diode, because you will be more happier to use it, because it's like the treatment is very fast, so not time taking, and definitely you will get a better results, because it's proper laser. It's a laser. IPL is a light treatment. Laser, you will have a better absorption, the better depth target, and you will have a superior results.
Thank you so much. Thank you. It's really, I really appreciate, because quite knowledgeable as well, because already I know lots of things, but it's quite good to just
Thank
see
you so
all this.
much. I'm so happy that all of you have enjoyed my lecture and
It's quite knowledgeable.
really liked it. Thank you so much. It's my
Thanks a lot.
pleasure. Yes, anyone else who want to ask any question if they have in their mind?
Yeah.
We have thanks so much for everyone joining us, and we have 5 minutes to go for this webinar. And I see on the backstage we have one last question asking what should be watts of diode to buy 1200 watts or 1600 watts from Rabia. Do you have any suggestions on that, Dr. Shehla?
So that is basically the speed. It would really affect the speed. Heavier machine is really definitely it would be good. It will really affect the speed of the treatment. So she can buy like 1200 to 1600 watt machine. So that's a good one.
Okay.
The most important factor to keep in mind is to buy from a very reputable company. That is really matter. You know, if you will buy a machine from the open market, despite it's like they claim like it's like 2000 watt or 25 or 3000 watt, doesn't matter. But you have to be, you know, to buy the equipment from a good company. And it's better to have an FDA for that equipment as well. So you will be in better hands later on. You will have better results because being a doctor, it's really important that you give the best to your patient. So that's why, you know, they will come again and again.
Okay. Thank you so much, Dr. Shehla. And also thank you everyone for joining us today. And we're really grateful how you keep learning and keep on updating the services and treatments to your clients. And I think that's very lucky for our clients and for us as well. And also, so as a summary, Dr. Shehla gave us a great lecture, which is very informative in terms of the skin and the hair, and also different technologies to treat hair removal treatments, and also great suggestions on factors to consider prior to buying a laser hair removal machine. And I think this is also very helpful for all of us. And I hope you learned a lot. Also, one last thing, all of the technologies and devices Dr. Shehla introduced us today are both FDA and CE certified. So they are very trusted and reliable equipment. And also in Europe, United States, and also other countries, we have the customer support manager looking after us for both training and also the technical services. Also, this is one of the very first, but not the last webinars we will be having for all of our great clients. And please do get back to us after this webinar, your thoughts or your feedback, suggestions, topics you'd like to hear from us next time. And this is very, very helpful for us. And I'm sure it's very helpful for all of our other clients out there as well. So we have come into the finishing time. Thank you so much, everyone, today. And we will see you next time. Thanks so much, Dr. Shehla.
Thank you so much, Kelsey. Thank you so much, all the participants. Who have just joined my lecture. I would really like to appreciate for all of you who have joined the lecture, who are part of it. Thank you once again.
Thank you.
Thank you. We'll see you next time. Bye.
Bye.